How do I find out if I have COVID-19 right now? Should I get a COVID-19 PCR test? How do I even get a COVID-19 PCR test? How much will I pay for a COVID-19 PCR test? If I test positive, what do I do? If I test negative, what next? You're in luck because we'll give you all these answers in this video. Hi everyone, my name is Dr. Weston Blakesley and I'm the founder and owner of Omatics Health. As with all information related to COVID-19, we need to start with an initial disclaimer. The information in this video is rapidly changing based on new research on COVID-19. And we will update this video when new applicable information arises. If you want us to make another video about how COVID-19 PCR tests work, please let us know in the comments. For now, we're going to stick with the logistics of how you get tested and what you need to do once you get your test result. COVID-19 PCR tests tell you if you're infected right now. In other words, it tells you if you're actively infected with SARS-CoV-2, the virus that causes COVID-19. PCR stands for the polymerase chain reaction, and it was invented by a scientist who claimed that tripping on LSD helped him invent the process. PCR is used in essentially every laboratory in the entire world, and it won this scientist the Nobel Prize. It's a true story. Alright, now that we got some fun history about PCR out of the way, should you get a COVID-19 PCR test? If you have symptoms for COVID-19, yes, you should get a test. Order one of these tests if you have any of these following symptoms: loss of smell or taste, shortness of breath or difficulty breathing, feeling weak or lethargic, lightheadedness or dizziness, vomiting or diarrhea, slurred speech or seizures. If you have plans to go see a loved one or a friend that's in a high-risk bracket for COVID-19, yes, you should get a test. The biggest reason for this is that you could be asymptomatic and could end up infecting a high-risk person. If you've recently been in contact with somebody who has tested positive for COVID-19, yes, you should get a test. If you're symptom-free but believe you may have recovered from a previous COVID-19 infection, no, you should not get one of these tests. COVID-19 PCR tests will not tell you anything in that situation. If you want to find out if you were previously infected with COVID-19, check out our video on COVID-19 antibody tests in the description below. The differences between a COVID-19 PCR test and a COVID-19 antibody tests are very important, because I've seen celebrities on social media post that they are positive with COVID-19 from a COVID-19 PCR test, and then that they're negative from a COVID-19 antibody test. A negative COVID-19 antibody test does not mean that your COVID-19 infection has gone away. These celebrities need to get another COVID-19 PCR test to ensure that they do not currently have an active infection. Alright, now how do I get a COVID-19 PCR test and how much are these going to cost me? Many state and local governments are setting up free testing centers to the public. Go to your state's website to find a testing center and make sure you get there early, because these testing centers only have a limited number of tests that they can administer every day. Another very important thing to know about when you're using these free testing centers is to find out exactly how long it's going to take you to get your results before you test at that center. Some states have backlogs of a week or more to get your test results back to you, and this is not good. We'll touch base on how important it is to get your test result back as soon as possible in a bit. Apart from your state's free options, we've included a list of COVID-19 PCR tests that are approved by the FDA for emergency use authorization. These tests will run you anywhere from $109 to $150. If you don't want a huge cotton swab stuck up your nose to determine if you're positive for COVID-19, we've listed options that require only your saliva, where you spit into a vial instead, in our link below. Be sure to check each company's estimated time to get you your results. Most of the tests that we've listed return results in less than 2 days, but be sure to verify this on that company's website, because this changes all the time due to demand. How quickly you can get your results back matters a lot. If it takes you 8 days to get your results back, that doesn't do you much good, especially if you need a negative test to return to work. The faster you get your result back, the better for you to either get back to work with a negative test result or to quarantine yourself for 14 days with a positive test result. We just touched on it a little bit, but let's go more in depth about what you need to do with your results. If your COVID-19 test comes back positive, quarantine yourself for 14 days to ensure that your infection has gone away. If you're pressed for time, you can always order another COVID-19 PCR test 5 to 7 days after your initial test result has come back to see if your infection has gone away. These tests are incredibly sensitive, so it's pretty rare to have a false positive result. If you get a positive result, it's safe to assume that you have COVID-19. Inform your doctor that you tested positive for COVID-19. There have been cases where people have long-lasting health effects and prolonged recoveries from their disease. And this way you and your doctor can come up with a plan to help you recover faster. Alright, your COVID-19 PCR test comes back negative. What do you do next? As we discussed earlier, these tests are very sensitive, so false negatives are pretty rare. If you get a negative test and do not have any symptoms, continue to follow your community's mask and social distance guidelines as usual. You still have symptoms, especially symptoms associated with COVID-19. There's a very small chance that you had a false negative test. Talk to your doctor about treatments and get tested again to make sure that you really are negative for COVID-19. And again, this way you and your doctor can come up with a plan to make sure that you manage your symptoms properly. At Omatics Health, we remain consistent that trust is our most important value. Our world is full of fake news and false remedies, and we will never steer our customers to methods or products that we do not trust ourselves. Our goal is to help you find the most cost-effective health information so you can be the healthiest version of yourself. All of the information we give you is for general information purposes only. At no time will our information take the place of professional medical advice, and no doctor-patient relationship will be formed during our services. It's up to you to use our information that we provide you at your own risk. If you're feeling ill, never hesitate to contact your primary care provider or visit your nearest urgent care or emergency room to make sure you're okay. We take our customers' feedback very seriously. If you have more questions, please leave a comment below. Find more helpful information from the FDA, the CDC, and the WHO in our description. Contact us on our website. And don't forget to subscribe so we can bring more videos like this to you. Thank you everyone, I hope you stay healthy and safe.